The learning objectives of today's topic are that at the end of the lecture, the student should be able to define the compartments of the arm, should be able to describe the muscle arrangement of anterior compartment of the arm. The student should be able to know the actions and the nerve supply of the arm muscles. The student should be able to describe the neurovasculature of the anterior compartment and explain the clinical correlation of anterior compartment of the arm. Bismillahirrahmanirrahim. Now you know that arm is the region which is present between the shoulder and the elbow. This part of the upper limb which is present between the shoulder and the elbow is called as arm. This arm communicates superiorly with the axilla. You can clearly look into the figure that superior aspect of the arm communicates medially with the axilla. The nerves and the vessels pass into the arm first by passing through the axilla. The inferior aspect of the arm connects with the forearm through the cubital fossa. Cubital fossa is a triangular area present anterior to the elbow joint, and it will be discussed in the next class. When you look the arm, when you dissect the arm, you find that it is divided into two compartments by the medial and the lateral intermuscular septas. Now these septas, these partitions arise from the deep fascia covering the arm and are attached to the humerus. They are attached on the medial and the lateral supraepicondylar ridges of the humerus. Now you remember that the limb is covered by skin. Beneath the skin we have a superficial fascia. Beneath it we have a deep fascia. Fascias are actually connective tissues. So the deep fascia is sending inside two septas, two partitions which are called as lateral intermuscular septum and the medial intermuscular septum. The two septas are attached on the humerus and they divide the arm into two compartments, anterior compartment and a posterior compartment. The anterior compartment is also called as flexor compartment because the muscles present in the anterior compartment are responsible for performance of a movement of flexion at the elbow joint. The posterior compartment is also called as extensor compartment because the muscle present in the posterior compartment is responsible for extension of the arm at the elbow joint. Now we will discuss the contents of the anterior compartment of the arm. The anterior compartment of the arm has three important muscles: coracobrachialis, coracobrachialis, biceps brachii, brachialis. So it has three important muscles which are present in the anterior compartment. There is brachial artery, brachial veins, musculocutaneous nerve, median nerve, ulnar nerve and the radial nerve. So in the exam, we can put a question that name the contents of the anterior compartment of the arm. So you have to describe, you have to enumerate the contents. There are muscles, three muscles: coracobrachialis, biceps brachii, brachialis, brachial artery, brachial vein, musculocutaneous, median, ulnar, and the radial nerve. We are going to briefly discuss each and every content of the anterior compartment of the arm. The first content are the muscles, and the first muscle that we are going to discuss right now is coracobrachialis. Now you can understand the origin and insertion from the name of the muscle. The name is coraco. You remember the coracoid process of the scapula? Brachialis. The humerus is also called as brachialis. So, the muscle arises from the coracoid process of the scapula, and it is inserted on the medial side of mid shaft of humerus. You have to understand the origin and insertion of the muscle, and then only you can understand the action performed by this particular muscle. So the name of muscle is coracobrachialis. It is arising from coracoid process, and it is inserted into the medial side of mid shaft of humerus. Now in the foundation module, we told you that most of the muscle, the origin remains constant while the insertion moves. So when this muscle will contract, when this muscle is going to shorten, it will pull the arm forward. Look into the figure. This muscle is crossing one joint, which is the shoulder joint, glenohumeral joint. So it is going to act on this joint. When this muscle will contract, it will pull the arm forward, and this movement is called as flexion at the shoulder joint. Now this muscle is attached on the medial side. When it will contract, when it will shorten, it will bring the upper limb towards the chest wall, and this movement is called as adduction of the arm. All the muscles of the anterior compartment of the arm are supplied by musculocutaneous nerve. So we will revise the muscle. Its name is coracobrachialis. It originates from coracoid process. It is inserted into the mid shaft of the medial side of the humerus. It is innervated by musculocutaneous nerve, and when it contracts, it leads to flexion and adduction at the shoulder joint. The second important muscle is biceps brachii. This is a very common muscle. You do biceps exercise, right? So this muscle is forming the main bulk of the arm. Biceps. Bi means two. So it has actually two heads of origin. Biceps brachii has two heads of origin. A short head and a long head. Look into the figure. The short head arises from the coracoid process, while the long head of the biceps arises from the supraglenoid tubercle of the scapula. Now you remember the scapula. It has a glenoid cavity, And just above the glenoid cavity, there is a tubercle which is called as supraglenoid tubercle of scapula. So the long head arises from the supraglenoid tubercle. Look into the figure. The tendon of the long head passes superior to the head of the humerus. It passes superior to the head of the humerus, and then it passes through the intertubercular sulcus present in the humerus. The tendon then runs down and joins the fleshy part of the muscle. So you have to remember this point, that the long head, the tendon of the long head passes between the intertubercular sulcus and is attached to the supraglenoid tubercle of the scapula. The fleshy part converges into a tendon, and the tendon is inserted into the radial tuberosity. Now in the forearm there are two bones, radius and ulna. The radius is on the lateral side. It has an elevation which is called as radial tuberosity. The tendon converges and is inserted into the radial tuberosity. Now look carefully into the figure. As the tendon enters the forearm, a flat sheet of connective tissue called as bicipital aponeurosis fans out from the medial side of the tendon and blends with the deep fascia covering the anterior compartment of the forearm. This band of aponeurosis is working as a protective band. It is covering the important nerves and vessels which are going to pass in front of the elbow joint and enter into the forearm. So what we are going to revise it now. The biceps brachii, as its name indicates, bi means it has two heads. Short head arising from coracoid process, long head arising from supraglenoid tubercle. The tendon of long head passes between the intertubercular sulcus. The fleshy muscle converges to form a tendon which is inserted into the radial tuberosity. From the tendon, a flat sheet of connective tissue, a band of connective tissue emerges, which is called as bicipital aponeurosis. It merges with the deep fascia of the forearm. So, now the origin remains constant and the insertion is going to move. So when this muscle is going to contract, it is going to flex the elbow. It is going to flex the arm at the elbow joint. Look into the figure. It is crossing the elbow joint, so it is going to perform the main function at the elbow joint. The biceps brachii is a powerful flexor of the elbow joint, as well as it is a supinator of the elbow joint. This muscle is also crossing the shoulder joint. So when it is going to contract, it will work as a weak flexor of arm at the shoulder joint. The main function is performed at the elbow joint, and the main function is powerful flexion and supination at the elbow joint. It is innervated again by the musculocutaneous nerve. Now look into the figure. When there is a road traffic accident or any injury, There is rupture of tendon of the long head of biceps brachii. It produces a characteristic deformity on flexing the elbow. There is presence of an extremely prominent bulge of the muscle belly. When the muscle will contract, when there will be flexion of the elbow, will be production of a prominent bulge in the anterior aspect of the arm, and this is called as Popeye deformity. It is called as Popeye deformity. Rupture of tendon of long head of biceps producing a characteristic bulge in the anterior aspect of the arm. The third muscle of the anterior compartment is the brachialis muscle. It is arising from the distal half of the anterior aspect of the humerus, and it is inserted into the ulnar tuberosity. Now remember, biceps was inserted into the radial tuberosity. Brachialis muscle, I'm repeating, brachialis is inserted into the ulnar tuberosity. It is supplied by musculocutaneous nerve as well as by the radial nerve. When this muscle will contract, it will lead to powerful flexion at the elbow joint. It is crossing only one joint, so it is going to produce action at the elbow joint. We have discussed the three muscles: coracobrachialis, biceps brachii, and the third is brachialis. All of them are supplied by musculocutaneous nerve. Now we are going to move the neurovasculature, which is present in the anterior compartment of the arm. The first and the important artery which is present in the arm is the brachial artery. The brachial artery begins as a continuation of the axillary artery at the lower border of the teres major muscle. The axillary artery runs in the axilla, and as it crosses the lower border of the teres major muscle, its name changes and now it becomes the brachial artery. The brachial artery runs in the arm. It ends in the cubital fossa by dividing into a radial artery and an ulnar artery. The course of the artery. Now look into the figure. In the proximal arm, the brachial artery lies on the medial side. In the distal arm, it moves slightly laterally. It crosses anteriorly to the elbow joint, and the important landmark is it lies immediately medial to the tendon of biceps brachii muscle. So whenever we want to palpate the brachial artery, we will palpate it medial to the tendon of biceps brachii muscle. This is a very important landmark. You have to remember this point, that brachial artery is lying anterior to the elbow joint, medial to the tendon of biceps brachii muscle. The brachial artery in the arm gives different branches. The first are the muscular branches which supply to the muscles. The second, it gives a nutrient artery. Look into the figure. It gives a humeral nutrient artery. The nutrient artery to the humerus enters the bone through the nutrient foramen. It gives a large branch which runs in the posterior compartment and is called as profunda brachii artery. It gives two more branches, a superior ulnar collateral artery inferior ulnar collateral artery. So altogether it gives 5 branches: muscular branches, nutrient artery to the humerus, profunda brachiae artery for the posterior compartment, superior ulnar collateral artery, inferior ulnar collateral artery. The brachial artery is used to record the blood pressure. It is the most commonly used artery where the blood pressure is recorded by the help of a sphygmomanometer. And you have to remember that it is present anterior to the elbow joint, just medial to the tendon of biceps brachii muscle. The veins of the arm. There are 2 types of veins present in the arm: deep veins and the superficial veins. Now look carefully into the figure. Deep to the muscles, deep to the biceps, you can see paired brachial veins which are running along the brachial artery. So there are 2 deep veins which are paired brachial veins. In the arm, there are superficial veins. There are 2 superficial veins in the arm: cephalic vein on the lateral side and basilic vein on the medial side. These superficial veins of the upper limb are going to be discussed in the future lectures. But till now, you should understand this point, that cephalic vein is running on the lateral side, and you can see it runs upward and it drains its blood into the axillary vein. The basilic vein is running on the medial side. We said they are superficial veins. It means they are present in the superficial fascia. Now the basilic vein runs subcutaneously in the distal half of the arm. It then penetrates the deep fascia and becomes deep, enters into the arm. It penetrates the deep fascia and continues upward and forms the axillary vein at the lower border of the teres major muscle. So, if I ask you how the axillary vein is formed, your answer will be it is the continuation of the basilic vein. The basilic vein, as it crosses the inferior margin of teres major, its name changes and now it becomes the axillary vein. So the basilic vein is a superficial vein in the distal half of the arm. It penetrates the deep fascia and continues upward and becomes the axillary vein. The paired brachial veins, deep brachial veins, enter into the basilic vein or they enter into the axillary vein. For anatomy, you have to see the images. You have to understand the images. Then you can memorize the anatomy. Okay, so we have done the muscles, we have done the brachial artery, we have done the veins. Brachial vein, cephalic and basilic vein. Now we are going to move to the nerves. The first and the most important nerve of this compartment is the musculocutaneous nerve. The musculocutaneous nerve arises from the brachial plexus. Look into the figure again. It is piercing the coracobrachialis muscle. Now it is an important BCQ point. It is piercing which muscle? The question is, which muscle is penetrated or pierced by the musculocutaneous nerve? Your answer will be musculocutaneous nerve pierces the coracobrachialis muscle. So it pierces the coracobrachialis. It runs between the biceps and the brachialis muscle. It then penetrates the deep fascia and continues as the lateral cutaneous nerve of forearm. The musculocutaneous nerve gives motor innervation to all the muscles in the anterior compartment of the arm. It gives sensory innervation to the skin on the lateral surface of the forearm. So is the concept clear to you? If it is not clear, you can message me on the Google Classroom. I am repeating, the musculocutaneous nerve arises from the brachial plexus. It pierces the coracobrachialis. It runs between the biceps and the brachialis, supplies the muscle, and leaves the arm by piercing the deep fascia, and now it becomes the lateral cutaneous nerve of forearm. It gives the sensory supply to the lateral surface of the forearm. The second nerve which is present in the anterior compartment is the median nerve. Now again you have to look into the figure. The median nerve enters the arm from the axilla at the inferior margin of the teres major muscle. Now look into the figure. In the upper arm, the nerve is present lateral to the brachial artery. Now you have to remember the course, the relationship, the position of the median nerve as well as of the other nerves. The median nerve in the upper arm is lateral to the brachial artery. In the lower arm, you can see it crosses the brachial artery and now it becomes on the medial side. In the lower arm, it crosses to the medial side of the brachial artery and now it is present medial to the brachial artery, anterior to the elbow joint. तो हमें क्या याद रखना है कि मीडियन नर्व लैटरल पे थी, फिर एंटीरियरली क्रॉस हुई और अब कहां पर आ गई? फाइनली मीडियल साइड ऑफ द ब्रेकियल आर्टरी. Okay, there is a clinical for the median nerve. Now sometimes there is an embryological remnant of the coracobrachialis. This embryological remnant is called as ligament of Struthers. It compresses the median nerve and the compression of median nerve results in weakness of the muscles of the forearm and the thenar muscles which are present in the hand. So till now, you just have to remember embryological remnant of coracobrachialis called as ligament of Struthers can compress the medial nerve, leading to weakness of the forearm and thenar muscles. The next nerve, which is median nerve, does not give any branch in the arm, it just passes and enters into the forearm. The next nerve is the ulnar nerve. Ulnar nerve also, it does not give any branch, it just have to pass through the arm and you have to remember its course. Now you can see in the figure, the ulnar nerve runs medial to the axillary artery as well as to the brachial artery. इसको परेशानी है, ये पीछे चल गया. What it does, it runs backward, it runs into the posterior compartment. Now what it does, in the mid-arm, it pierces the medial intermuscular septum and enters into the posterior compartment, and you can see in the figure, it is running just behind the medial epicondyle of the humerus. So you have to remember the course of the ulnar nerve, and what the course is. It is a very naughty nerve. It is running on the medial side of the brachial artery in the mid-arm, pierces the septum enters into the posterior compartment and runs just behind the medial epicondyle of the humerus and enters into the forearm. आगे वो क्या करती है देखा जाएगा. The radial nerve, again you have to learn the course. It enters the arm and it immediately enters into the posterior compartment. Now in the mid-arm, the radial nerve pierces the lateral intermuscular septum and enters into the anterior compartment and lies anterior to the lateral epicondyle of the humerus and enters into the forearm. So this is how the nerves, they are passing from the arm into the forearm. They are taking different routes. कोई हैदराबाद जा रहा है, कोई कराची जा रहा है, कोई सक्खर जा रहा है. So they are passing, actually they all are going into the forearm but taking different routes. And you have to memorize their course. Thank you so much. If you have any